All right. So next step, in the cart, you're going to find various different things. The first thing we'll grab is this half drape. And when you open this up, it's a sterile field. And so the majority of us are going to put that on the surface of the Bronch Cart. Some people will choose to use a Chucks. That's their choice. Doesn't matter. There's no right or wrong, but these are available to you if you were to want to use them. The other thing that's in this drawer is the first step, which is what we're going to use at the end, even though it says first, right? A little chuckle there.
It's a first step before cleaning.
Yes, the first step. We have sterile gloves here, surgical gloves. We used to prepare it for doctor. We don't always do that anymore, but they're there, available. The drawer above is going to have any of our specialty items. So we have our brushes, forceps. If there's something doctor wants to use that we don't have, Bronch Lab would be our resource for that. But typically we're not utilizing slides and formalin when we're doing bedside bronchs. The drawer above is going to have all the supplies that we're going to need. Again, we can pull items from this area, but let's be sure to restock it, because the worst thing is when you're in the middle of something and you don't have what you need. So we have supplies here. We also have supplies in this top area. I always like to grab, well, usually there's a permanent marker in here. I'll show you what I do, but there's gauze, your lube, what we use for if we had to numb up, which will be a separate educational piece, but those items are here, as well as the rhino if doctor had to do a bedside, and then our go bags. So we make these, and the goal is to have everything that you need to do a bronch in one bag, so you can just grab it and go. Of course, we'll replace it when we're done, but it makes life way easier. So we have denture cups. This is what we'll put water in. We have specimen traps. We have one of each of the little ports that we use, attachments. Then there's also the blue bronch adapter. Now this goes on the end of the endotracheal tube, the ET tube. Between the tube and the circuit, you're going to remove your inline suction catheter, but this is going to allow doctor to enter. Here's our tube, here's our circuit, doctor's coming in through the top, okay? And then we just put that little piece of plastic over it, and it's going to allow for a seal and a cap. When I do a bronch, I always open up my suction, my sputum traps, my Lucan traps. And what I'll do personally, okay, I'm going to waste it. I'm going to show you what I do, is if doctor wants to take washings, sometimes in the heat of the moment, number one, they're soft-spoken. Number two, they're fast and they're concentrating. So they're not going to be overtly saying left lower lobe, right upper. So what I like to do personally is I'll number my sputum traps. So number one, and I usually do one, two, or three, and each one I number. Then on a scrap piece of paper, when we're in the middle of the bronch and I can't label the Lucan's trap that they are using, I can at least write down here, number one, right lower lobe. Number two, right middle lobe. You know, whatever you need to do to make that happen.
But it is best to have a permanent marker, because then you're writing directly on the trap.
Yes. Yep. So that's that.
Typically, the to-go bags were mainly for when you're using the glidoscope for bronching.
Yes.
That scope. Because otherwise, everything you really need is in this cart, that you shouldn't have to grab the to-go.
I would agree. I would totally agree. If we're going to use the disposable, yes. Or like you said, we're going to just grab this bag and go and not take the whole cart. You don't have to use the cart. A lot of us like it for the surface, and if we need something else, but it's not required.
No.
The gauze. So what we'll do is we'll open up the gauze, and I like to have two separate. I keep one dry and I get one wet. So I take the lube because doctor's going to want to lubricate the end of that scope. So I just put all kinds of lube. Could have been a bigger, right? So this is my wet one, which I'll hold like this, and doctor will drag the scope through it. But then later during the bronch, if doctor needs me to hold the ET tube, I like to have a dry gauze so that I get a better hold of it. It helps because everything's wet and we already use lube. Like, it just kind of helps make it a sturdier surface. The water. So we're going to spend it here, guys.
Just
spend it. Okay. We'll fill up our water. If I'm bronching by myself, sometimes I use 2 waters because 1 water, 2 syringes. I always use 2 syringes. So I'm going to draw it up. Now this is a slip tip. It's not a lure lock syringe. So this is a slip tip, meaning it's going to fit into our bronchoscope hub. That smaller circular gray piece we put on the scope, this will fit inside of that. Yes. And so that's what doctor's going to do is flush. So we'll draw that up. Now, I like to just leave it so that when, I'm not going to do a second one, but imagine that there's 2. Some of us will draw it up and leave it in the cup. Others will draw it up and place it on the patient's chest so it's within arm's reach. Totally up to you how you want to practice, but essentially as long as you have this so that doctor can do washings, that's the goal. And again, slip tip is super important because the other kind's not going to work. And we'll practice. I'll show you how to take a trap off while you're doing a bronch, but I don't think it's conducive to this right now. So that's pretty much that. If doctor wants to bronch with a BiPAP, we have, we have the orange elbows that we use. The green elbows are for bronchs because we can, doctor can enter through the end of the hub here. The only problem is for some of these, we would want to have them numbed up. So if they're not numbed, this is a whole different ballgame. So we will cover that.
okay.
Cool.
Questions? Email on Teams, Trina, or your other resources, Larry.
Ooh, should I talk about cleaning it? Yeah, let's do it.
Let's do it.
Let's just make it we'll just do the whole thing.
Let's just make it a 20-minute video. Next, it'll be a dance.
Yeah, no problem. Okay, so this is the bronch guide that is on the Bronchoscope cart. And really, this is something that will beef up so that you all have a resource available to you. But on the back, when they said tracking sheet, so when you use it, when you're sending a scope to sterile processing, put your name and the date. And then when it comes back to us, it'll be delivered to the ICU nurses station. They'll let us know. And when you put it back onto the Bronch cart, if you could please date and then your name here, so we make sure that we're staying on track and that we're on top of where the stuff is. When we are going to clean our bronchoscope bedside, we want to do it immediately. Like as soon as doctor leaves the room, or even before that, we're starting to get our stuff cleaned up. And so we're going to use that first step solution. And when should I open it? No. Okay, so we're going to open it up. Inside is a blue rectangle sponge. And what you'll do is you're going to take that sponge and you're going to wipe the entire base of the bronchos, the scope itself. You're going to, hi Dr. Bailey, you're going to clean the end of the scope. I can't even. But then after you've cleaned it thoroughly, you'll take the scope itself and put it inside of the bag of solution, and you are going to suck all of that out of there. Every all the entire solution, because what that's going to do is it's going to clean from the inside as well as then on the outside. When you've utilized the first step solution, then the scope can go back into its container and brought to sterile processing. The trick is we need to fill out one of these sheets to take with it. And I've already kind of set it up, so all you have to do is choose which one we're using. So you'll see here, eyepiece, we don't use that one. Once in a blue moon, but this one, tower scope. That's the one that you're going to check. So it's the date. We want a patient sticker here. If they're on any precautions, what time was the scope removed from the patient? So what time did you stop the bronch? Did you pre-clean at the bedside? Sure did. That's our first step, which is the last step. And then what time was it pre-cleaned? These times should be pretty darn close to each other. And then we're supposed to bring the scope to sterile processing on 4R. And then when it's finished, they will bring it down to the ICU, and then we will check it back in. Very good. Thank you.